Hi all. I have cleared my anaesthesia residency with good marks and have become ASR now. And the most frequent questions that have been asked is, sir, tell me how to approach anesthesia. No matter what the year is, what should be our plan so that ultimately the end result becomes very smooth. Now, because I have already cleared the step and have come on the other side, the bare minimum I can do is to share what I feel right now. The bare minimum, that what additional things that I could have done, or what exactly you can follow so that you can sail through the exams, you can sail through the residency quite smoothly. Now, if you have your own plan, that is perfectly fine, and this video is not a recommendation to stick to something that I have told you, but it is something which will definitely help you clear out the confusions that you have right now, and it will help you sail through it quite smoothly. Let's get to the plan. Right, so let's begin with the general approach of the PG residency. We'll start with the third year because ultimate aim is to clear your exam, which will include your theory and your practicals. Once you have this knowledge, the part of this knowledge is accomplished in second year and first year. So I'll tell you the ultimate aim and which part of that particular aim can be covered up in your second year and first year. So the people who are in their first and second years can actually try to complete that part in their particular years, and final whatever is left will be dealt in the last year. The people who are already in their third year obviously cannot cover that thing in their previous years now, so they have to complete the rest of it in this year itself. Let's talk about the theory first. In theory, the approach can either be you try to do the previous year questions directly year wise, or you can segregate them into systems. Now the benefit of segregating them into systems will be, because if you're dealing one type of question of a particular system, the same type of question is has more propensity of being remembered. But if you do random questions in your previous year questions, then you'll feel lost till the very end. You do not require more than 1.5, approx 1.5 or 2 months maximum is required to complete one reading of the theory questions system wise. Why I'm saying so? You see, I have done it very recently. That is why I'm telling that even if you are very slow, you have 14 to 16 units. Now, obviously, in these units, you know the types. There are systems like there's CVS, there's RESP, which are comparatively larger units. You have smaller units like ENT, Ophthal, OBGY, ICU. It may look large, but ICU comparatively is a smaller unit because you cover the mechanical ventilation in your respiratory system. Then there are other random units, and obviously, what is left with will be some miscellaneous. Now, this list, if you are a candidate from RML hospital, this list is already prepared. We, as the 2021 batch, have used it. So, this can be shared very easily. You just have to add up the last year, the current year question papers into it, and you will be done. So, the ultimate aim is to go system wise and complete these systems. And once you complete the systems, how do you approach a particular system? I'll take an example for ENT. I'll show you my notes how I finished my individual units. This is the same approach you should use in your individual units so that you feel complete and you have knowledge for your theory, and you'll able to know how to write an exam, how to make notes which will help you in your theory exam, because you have very limited space to write. So you should know how to write the notes, how to prepare notes for your exam preparation. At the end, you won't have that much time to revise, and you won't have that much time to write it down. So and ultimately, the topics which are overlapping from the practical, those are the ones you have to segregate knowledge, which knowledge to be revised before practical and which knowledge has to be revised before the theory. Let me show you an example with the ENT. Uh, yes, you can see that I have made a previous year question. So this is the list. Now in a particular system list, you'll have three types of questions. Three type of questions in a unit. Suppose it is ENT only. There will be questions related to cases. Now the cases can either be which are a part of your practical exam, either a long case or a short case. For these type of cases which are your part of practical, obviously they are very important because these learning about these cases will help you in both. But the problem will be for writing this case in theory and presenting this case in your practical exam is a different thing. So you need to make notes for this theory, plus whatever additional knowledge is required, you have to segregate from that simplified notes. So you should have some simplified format for the pre, intra, and post-op area. This and along with the concerns, which you divide it into patient related concern, surgery related concern, and anesthesia related concerns. So this format what I am talking about is the concerns and the pre, intra, and post-op. What do you do in pre? What do you do in intra and post-op? This is something that you have to make segregated notes, simplified notes for that particular case. And what do you mean by then additional knowledge? Whatever additional is asked in your practical, you know that suppose if it is a case of thyroid, now you have already made notes for pre, intra, and post-op. You know how to conduct a case. Now you know the concerns divided into three headings. But do you think only these questions are asked in a practical exam? Obviously no. You have to ask about the detailed history part. You have to remember about what is the physiology of like thyroid synthesis, thyroid hormone synthesis. Then they may ask you difference between T3 and T4, right? They can give you different case or clinical scenarios. They may ask you like the thyroid or the anti-thyroid drugs. You can see there's no end to these additional questions, and these additional questions are the ones which make a practical exam difficult, because you don't know what in what sequence the examiner is going to go. But what is constant is you should know what specifically to ask in pre-operative, the investigations, the advice specifically, the intraoperative, what may be your case type of case, a GA or regional, what are the alternatives of conducting that case, and what specific things to look for in post-op, and beginning every question with concerns. This is one single thing which can fetch you the most marks. I'll give you example. I had attempted in my centups 10-mark questions in 10 minutes, 3 questions, and I got 3, 4, and 3 marks in each out of 10, and I only wrote concerns. So can you imagine, I did not write about pre, intra, and post. I just wrote about concerns. This single thing made me clear about how to conduct that case, because if you know the concerns and divide it into these 3 categories, you already know what to ask in your pre, intra, and post-op. So that is how important the only writing concerns for a case can actually make you clear the exam, and whatever additional you write will get you more marks. For the case scenario, whatever cases where I got almost full marks in the final exams. That is how I got the highest marks in my third exam, if in which I actually attempted only 95 marks and got 78. So it is basically the importance of these concerns which I wanted to focus upon, and to segregate the knowledge from the additional knowledge for the practicals. Now you have other types of cases which are not a part of your practical exam. For example, if you see the previous year questions, there will be question from suppose epilepsy in your CNS unit. Now, this epilepsy is usually not a long or short case in your practical exam, but theory question is asked. So for that, you just have to follow the same sequence, this one. And they obviously the additional knowledge which is given in the books, you need not remember that. Also, example, suppose that is myasthenia gravis. Alright. Now people may say you should know what is myasthenia gravis, what is the pathology of myasthenia gravis and what and not. That all is not asked in your theory. They are usually either asked your concerns, anesthesia concerns, and how do you manage a case. And management means concerns plus pre, intra, and post-op only. So you need not remember the additional component for the cases which are not part of your practical exams. That will only waste your time. There are several such cases which are only asked in theory and not in practical. Another one is like suppose GBS is asked. All right. So suppose ECT is asked. These are not the usual practical cases, and you won't be getting these cases in practical. So you just have to know what are the concerns and how do you conduct it, and write a theory answer. Let me show you an example of how to write these example is adenotonsillectomy. See, I've written this case. In this case, this knowledge, you can see what you can see on the screen. This is the anatomy, this is the indications, the methods of tonsillectomy, then you have contraindications. So these are the additional knowledge for tonsillectomy, but what you have to write is concerns. Right now, this concerns in finally dividing into this pre-op, the points in that, OT preparation, intraoperative, and post-operative in your own terms. This is the way you will have a segregated knowledge for your theory. And if you add to this additional knowledge, your case is ready for your practical again. Once you move on from the cases, now what else is asked in your particular unit? Now there will be questions related to, after the case, there are questions related to certain topics. For those topics that you have to segregate whether they have some practical significance or not, or they are just solely theory importance. If they are solely theory important questions, you just have to make notes or take screenshots, because they don't matter too much. You just have to get a content good enough to write one page. If you have that much knowledge for that random solely theory oriented question, and that is only a topic which is not a case, so you don't have to go into depth or try to make notes for that particular thing. There will be topics which are practically important. Suppose in the ENT there are like OT fire, or there are laser surgery, concerns for laser surgery. So there are questions which are they have practical significance. So you should try to focus, because this will improve your practical knowledge also. Then there will be third type of topics, which are only asked in exam, and they are recent. So these recent updates for individual units, if you are a candidate of RML, you already have a list of recent advances. So that all topics are related to that. So if you do a particular system, you can do those questions which are asked in the recent list. Those questions are usually not important practical, because people are not doing that at the moment. For example, there are topics for artificial intelligence, or there'll be questions on SEDASIS or ERAC, or suppose esophageal echocardiography or ECMO. These are topics which are usually not done in your daily practice, but they are a part of your recent advances. For those topics, doesn't matter from where you have read it. Trust me, these are the topics which are only part of your third year, and you have to do it in the end, because there's no end. This list is very long. It will consist of 70 to 80 such recent advances questions, and this will take a lot of time. And There's no possibility that uh, actually focusing too much on it will give you that much of result. So you should focus on the cases, especially those asked in the practicals. Make the notes that I have made. I've told you that how to write the theory part and segregate it from the additional knowledge asked in the practical. Then specially focus on the concerns and the pre-intra post part for the questions which are only asked in theory. You don't have to read the additional knowledge. You don't have to read what is GBS, what virus causes GBS, and no one is going to ask you that. You should know what are the anesthetic concerns. You have to finish the cases like that. Then in topics, try to focus more on the topics which have practical significance, because nowadays they are asking more of these practical topics and the complications. Especially suppose if it is a thyroid case, so the complications of thyroid, the vocal cord palsy, the tracheomalacia, these are the topics which have much more significance as compared to the normal solely theory asked questions. Those for them you just have to write from where you have read it, and single reading that will suffice, because they have very less chances of getting repeated. And for the third thing, which are the recent exam questions, which you have to do at the end. Now, the which part of this should be covered up in the second year, that is important. So the cases which will be asked in practical, you should have a list in your second year, that these are the long and short cases. So the second year, this component which I am labeling now, this component, cases asked in theory, also in practical, and you should have the notes for pre, intra, post, and the concerns. If you do this part for all the long cases, we are suppose there are 10 cases, 10 long cases, and suppose there are 10 short cases. There are about 20 such topics for which you should have this format, and this is a part which you should ideally complete in your second year, because in the third year you'll be also be focusing on the topics which like this, which are asked in theory as cases but they are not asked in practical. Then you have to also focus on the topics which are solely asked in theory, and then all obviously the recent advances topics. So you won't be able to remember it for long. You have to revise it recently, so they will be asked in your third year itself. And the second thing to focus in the second year, apart from this segment, is the practical things. This thing, the topics, important topics in individual cases. Suppose in thyroid there are thyroid complications, or in the obese patient you have stop bank questionnaire. So those important topics you have to read in your second year itself. This was about the second year. Now what will a first year do? Let me tell you about the first year now. Now for the first year, you got to remember about the skills, because this is the time when you are the one who will be getting most of the cases, most of the procedures to be done. Like you should know how to intubate using different scopes. You should try to insert as many supraglottic devices as you can. Try to use your fiber optic, if not in the first year, the beginning of second year. Then you should be familiar about ultrasound, not about the nerve blocks theory, but in general, how do you prepare an ultrasound? How do you actually prepare your trolley for getting the nerve blocks? So these preparation parts, the general preparation parts, should be a part of your first year learning. And the most important being, if you are given some orders, the reflexes in working quickly on the orders will help you get a sense that you are good enough for this branch. Otherwise, if you work slowly and the senior says that you are too slow to act, ultimately even after having knowledge you won't be able to act fast. So the developing reflexes in the first year is very important. Then you get to know the general PAC, all the components of your pre-anesthetic checkup, not the individual investigations, not the individual orders for a particular case, because that will come when in the second year you'll segregate into pre, intra, and post-op and write down the important points yourself. When you write down the concerns yourself in the second year, then only you'll be able to know specific things. Otherwise, just go with the general PSC. Then you should know how to conduct a general GA case with no complications, how to give spinal regional anesthesia, and the general differences in the different OTs. That means, suppose you are posted in pediatric OT. Now, so there's a general preparation for every pediatric case. Whatever important is important practically, you should know that. If there's an obese patient coming, what all to prepare in your OT in that thing. Especially the patient who are suppose neurosurgery patients. So you should know what what are the exact things you should prepare in your OT regularly, no matter what the case is. So those general considerations are part of your first year, and try to attend workshops and quizzes in the first year, so that you open up your mind to the possibilities of anesthesia, or else you'll get into a monotonous phase. The first year will end, and you won't be having a general consensus what exactly anesthesia is. And I have written some of the topics: laryngospasm, desaturation, airway edema, hematoma, difficult airway, arrhythmias, pneumothorax, air embolism, increased temperature, tachycardia, hypertension, decrease or increase in EtCO2, decrease in urine output. These are subtopics which no one can avoid. Whether it is a practical scenario or a theory questions, these topics will remain important no matter whether you are first year or a second year or a third year. So whenever you see such a case, whenever you do a troubleshooting, try to focus on them. That's all I wanted to tell you. Thank you.